This research project is entitled Assessment of the Focus of Attention in Spatialized Sound Stimuli using P300. The authors are Douglas Abreu and Bruno Masiero. Lack of attention is one of the leading causes of school failure among children. This problem may manifest in several diseases, including Central Auditory Processing Disorder, or CAPD. The CAPD is best defined as a central processing disorder caused by deficits in rapid temporal processing and in the accurate representation of auditory space. This deficit may result in inability to recognize binaural cues used by the cans to separate target sounds during the listening process. A diagnosis of CAPD in children over 6 years can be obtained with the Listening in Spatialized Noise Sentences test. However, this test has the disadvantage that it requires a collection of equalized target sentences in the native language of the patient and is also susceptible to errors caused by the test operator. Human brain activity can be observed through electrophysiological procedures such as auditory evoked potentials. The long latency auditory evoked potentials, or P300, are performed by focusing the individual's attention on stimuli. We hypothesize that by paying attention to binaural stimuli that differ only in their perceived position, the P300 response will also be observable. If this hypothesis is confirmed, a second hypothesis will be tested that in patients with CAPD, the stimuli will not elicit a P300 response. This research aims to evaluate the possibility of identifying a central auditory processing deficit by electrophysiological procedures. These are the specific objectives of this project: evaluate neural activities when using a traditional sound stimulus, evaluate neural activities when using a sound stimulus with spatial cues, and characterize abnormalities in the analysis of the P300 in individuals with disability in recognizing binaural cues. The electroencephalogram equipment will be OpenBCI Cyton. The evaluation will be done through the standard procedure for performing the P300 for auditory stimuli using the 10-to-20 system for electrode placement. 300 frequent and rare syllable stimuli will be randomly presented. The evaluation will be initially performed with the traditional P300 and subsequently the stimuli will be altered, including spatial positioning, and will be conducted by using binaural system. With the method proposed by this research, it is expected that patients with CAPD can have an early and reliable diagnosis. This evaluation will allow for starting treatment early and obtaining higher success rates.